So levels of disease prevention. Primordial levels of prevention. It means before the emergence of the risk factors. So what is the objective? The objective is prevention of the emergence or development of the risk factors. Primary level of prevention, risk factors are present, but the disease is yet to develop. Okay. So the objective is to reduce the incidence and possibility that the disease may occur. Secondary level of prevention, the stage of intervention will be the early stage of the disease where the early symptoms are present. The objective is to halt the progression of the disease at the incipient stage. And tertiary means it's a late stage of disease where the intervention is being made. So the aim is to limit the impairment and the disabilities. Okay. So minimize suffering caused by the existing departures from good health. So to summarize, primordial prevention, risk factor and disease both are absent. In case of the primary prevention, risk factor is present, disease yet to develop. Secondary prevention, both risk factor and disease present. Whereas in case of the tertiary prevention, risk factor, disease present, also the complication is there. Okay. Now what is quaternary prevention? Quaternary prevention means it's a new concept. It's preventing the general public with the overdiagnosis of disease due to medical literature reviews. Now what are the examples of some levels of prevention? A class of 10-year-old children is discouraged from adopting harmful lifestyles like smoking and drinking. So basically you are trying to prevent the emergence of risk factors. So this will be what? This will be the primordial level of the prevention. A child coming to the immunization clinic for OPV. Now see, it means the threat for poliomyelitis is there. The risk factor is there. Disease yet to develop. So this will be a primary level of prevention. Okay. Primary level of prevention. Because why? Because this infection is already present in the community. This will be primary level of prevention. A person sleeps inside a bed net. This will be what? Primary level of prevention. See, risk factor is there. Mosquitoes are there which can transmit dengue virus, which can transmit the malarial parasite. Okay. So sleeping inside a bed net will be an example of primary level of prevention. When a student enters the medical college, he or she is given hepatitis B vaccination. This is example of which level of prevention? Vaccination again. This will be what? This will be a primary level of prevention, specific protection. Why? Because risk factor is there. The risk factor is there. That is the hepatitis B virus. Okay. In the community or in the patients. So risk factor is already present. So it's primary level of prevention, specific protection. Rabies vaccine, post-exposure is which level of prevention? Post-exposure is what? Primary level of prevention, specific protection. Because what can happen is that after a dog bite, the risk factor is there. The dog may or may not have the rabies, but the risk factor is there. Okay. So it is primary level of prevention, specific protection. Vaccine is given after a dog bite. So risk factor is already there. Rabies vaccine, pre-exposure like given in dog handlers in which level of protection? Pre-exposure. Okay. So see, dog handlers, veterinary doctors, monkeys, catchers, people going to expedition in an area where there are vampire bats exposed to risk factor. So again, this will be what? Primary level of prevention, specific protection. Tetanus toxoid vaccination after an open wound injury is example of, this will be what? Open wound injury means your injured area is contaminated with the soil, dust, and the soil and dust may contain the spores of the Clostridium tetani bacteria. So risk factor is present. So again, this will be what? Primary level of prevention, specific protection. Taking these vaccines, Cervarix, Gardasil vaccine, example of which level of prevention? Cervarix and Gardasil are actually vaccines against the cervical cancer, against the virus called human papillomavirus. So risk factor is there, primary level, specific protection. Capsular polysaccharide pneumococcal vaccine given 2 weeks before splenectomy. Again, this will be what? Primary level, specific protection. BCG vaccine used for the treatment of bladder cancer. BCG vaccine used for treatment of bladder cancer. See, vaccine, but you are using for the purpose of treatment. So whenever we are going to early diagnosis and treatment, it will be what? Secondary level of prevention. Use of condoms before coitus, example of primary level of prevention. Why? The risk factor is there, risk factor for transmitting STD. Okay. See, since it protects against transmission of any STD and it protects against the possible pregnancy. So again, primary level of prevention. Use of OCPs to treat PCOD or use of Saheli in the treatment of postmenopausal osteoporosis. Again, look at the word treatment. Whenever you are talking of early diagnosis treatment, it will be secondary level. Peripheral blood smear done for malaria is an example of. Peripheral blood smear is what? It's an investigation. So any investigation, person must have come to OPD with chill and rigor, then only you are doing this peripheral blood smear. So this will be what? Secondary level of prevention. Blood culture or Widal test is done for typhoid is an example of, again, investigation. Blood culture Widal test will be done whenever the person will show symptoms of typhoid. Okay. So this will be again secondary level of prevention. 30-year-old male is taking DOTS treatment, directly observed treatment short course. It will be what? Secondary level of prevention. It's a treatment. Multi-drug therapy in leprosy, again treatment, secondary level of prevention. ACT, artemisinin combination therapy, drug of choice in malaria, so it will be what? Secondary level of prevention. Wearing seat belt or helmets, which type of prevention? What is answer? So risk factor is there, risk factor of road accident is there, so it will be what? Primary level of prevention. Primary level of prevention, risk factor of road accident is present, okay? So it's a specific protection against what? Head injury. Doxycycline given for short-term chemoprophylaxis. So see, look, this is for chemoprophylaxis, not treatment against malaria. Under National Vector-Borne Disease Control Program, this will be example of what? Primary level of prevention. Primary level of prevention, why? It's a specific protection against malaria. Amniocentesis conducted around 14th to 16th week of gestation, example of. So this is what? Basically one investigation to see if there is any sort of fetal chromosomal anomaly, okay? So this will be what? This will be secondary prevention. So it's an investigation, so it's early diagnosis, secondary level of prevention. Iron folic acid tablets given in pregnancy is an example of which level of prevention? So tablets given in pregnancy. So possibility is there that in pregnancy there is the risk factor for anemia, okay? So it will be what? Primary level of prevention. So given to all pregnant women, risk factor of anemia, so primary level of prevention. Crutches given in polio, example of what? This is an example of what? This is an example of rehabilitation, okay? It's a tertiary prevention rehabilitation, not disability limitation, because if you give crutch, does not mean it will halt the progress of paralysis, okay? Physiotherapy in polio is an example of disability limitation or rehabilitation. This is what? Disability limitation, okay? By physiotherapy, there is a chance that progress of paralysis can be limited. And also, by maintaining some muscle strength, he can perform some movement, okay? So you can also call it both disability limitation and rehabilitation. Using spectacles, examples of. Spectacles are what? Tertiary level of prevention. Why? Because it will limit the disability, as wearing spectacle will improve the visual acuity. Intraocular lens implantation, it's a treatment. So treatment will be what? Secondary level of prevention. LASIK, again treatment, secondary level of prevention. Mobile eye clinic, this is another national program for the control of blindness. Okay, this clinic will go from village to village to diagnose cataract and refractive error. So it is what? Regarding diagnosis, okay? Early diagnosis to prevent any sort of future cataract and refractive error. So it will be a secondary level of prevention. Which of the following is a primordial level of prevention against malaria? Primordial level of prevention is what? You are trying to prevent the emergence of the risk factors. So it will be what? Source reduction. So insecticide treated bed nets, mosquito repellents, DDT, Gambusia introduction, all examples of primary level of prevention, okay? But source reduction or elimination of breeding place can prevent the emergence of risk factors. So this will be what? Primordial level of prevention. Okay. So we have discussed a lot of examples regarding the levels of prevention with regard to questions. So go through these questions once again so that you don't miss out on this particular topic. Thank you.